Medical experts identify 5 key differences between rheumatoid arthritis and osteoarthritis that may help you recognize which type affects you. If you've been confused about these two conditions, you're not alone. They share the word arthritis. They both cause joint pain, but they're fundamentally different diseases. Understanding these differences matters because the treatment approaches are completely distinct. I'm going to break down exactly what separates these two conditions, the specific symptoms that distinguish them, and most importantly, what this means for getting the right care. By the end of this video, you'll know how to recognize the key differences and when it's time to see a specialist. Let's start with why this confusion exists in the first place. Both conditions affect your joints. Both can cause pain and limit mobility. The word arthritis literally means joint inflammation, so it makes sense that people lump them together. But here's what most people don't realize. The underlying causes are worlds apart. Think of it this way. Osteoarthritis is like your car's brake pads wearing down over time from normal use. Rheumatoid arthritis is like your car's computer system mistakenly sending signals to destroy its own parts. Same result, completely different mechanism. This distinction isn't just academic. It determines everything from which doctor you see to what treatments will actually help. Getting the wrong diagnosis means pursuing treatments that won't address the root cause. Now let's talk about osteoarthritis first, since it's the more common of the two. Osteoarthritis affects approximately 32 million adults in the United States, according to the CDC. It's primarily a mechanical problem. Your joints have cartilage which acts as a cushion between bones. Over decades of use, this cartilage gradually breaks down. Without that protective cushioning, bones start rubbing against each other. That friction causes pain, stiffness, and eventually changes to the bone itself. The wear-on-tear nature means osteoarthritis typically shows up later in life. Most people develop symptoms after age 50, though certain factors can accelerate it. Previous joint injuries, obesity that puts extra stress on joints, and genetics all play a role. The joints most commonly affected are those that bear weight or get repetitive use. Knees, hips, hands, and spine take the brunt of it. That makes sense when you think about what gets used most throughout your lifetime. If you're finding this breakdown helpful and want more evidence-based health content, go ahead and hit that subscribe button. I analyze research and break down complex medical topics every week to help you have more informed conversations with your healthcare providers. Now, let's shift to rheumatoid arthritis, which operates on a completely different principle. This is an autoimmune condition, meaning your immune system mistakenly attacks your own body tissues. In this case, it targets the synovium, the lining of your joint membranes. When your immune system attacks this lining, it causes inflammation. Chronic inflammation then damages the cartilage and bone within the joint. A 2021 study published in The Lancet found that untreated rheumatoid arthritis can lead to joint deformity and disability within just 2 years of onset. The autoimmune nature creates a very different age pattern. Rheumatoid arthritis typically develops between ages 30 and 60, much earlier than osteoarthritis. It can even affect children though, that's less common. The joints affected also follow a different pattern. Rheumatoid arthritis tends to be symmetrical, meaning if your right wrist is inflamed, your left wrist likely is too. It often starts in smaller joints, like fingers, wrists, and toes, before potentially progressing to larger joints. Here's something important about autoimmune conditions. They don't stay confined to one area. Because the immune system is systemically activated, rheumatoid arthritis can affect your entire body. Some people experience fatigue, fever, and even complications in other organs over time. You're halfway through this comparison, and if this information is clicking for you, drop a quick comment below. Now the critical part most people miss. Recognizing these differences early can significantly impact long-term joint health. Let me walk you through the 5 key differences that matter most for recognition and treatment. Difference number 1, the underlying cause. Osteoarthritis results from mechanical wear and tear on cartilage, often accumulated over decades. Rheumatoid arthritis stems from immune system dysfunction, attacking your joint lining. This fundamental difference explains everything else that follows. Difference number 2, symptom patterns. Osteoarthritis pain typically worsens with activity and improves with rest. Your joints hurt more at the end of the day after you've been using them. Morning stiffness usually lasts less than 30 minutes. Rheumatoid arthritis creates the opposite pattern. Morning stiffness lasting more than an hour is a hallmark sign. The inflammation is worst when you've been still, which is why people with RA often describe feeling like the Tin Man from Wizard of Oz when they first wake up. Movement actually helps reduce the stiffness temporarily. Difference number 3, onset speed. Osteoarthritis develops gradually over years. You might notice subtle changes, like occasional knee pain after long walks, that slowly progress over time. Rheumatoid arthritis can have a more abrupt onset. Some people notice significant symptoms developing over weeks or months. The inflammatory nature means flare-ups can happen, where symptoms suddenly worsen for a period before potentially improving. Difference number 4. Affected joints. We touched on this earlier, but it's worth emphasizing. Osteoarthritis favors weight-bearing joints and those with repetitive use: knees, hips, hands, spine, and the base of the thumb. Rheumatoid arthritis commonly starts in smaller joints of the hands and feet, particularly the knuckles and the base of the fingers. That symmetrical pattern, where both sides mirror each other, is a strong indicator. It can also affect wrists, elbows, shoulders, ankles, and knees. Difference number 5. Systemic symptoms. Osteoarthritis is primarily a joint condition. You won't typically experience fever or fatigue from osteoarthritis itself, though pain certainly can be exhausting. Rheumatoid arthritis, being an autoimmune condition, often comes with systemic symptoms. Many people experience persistent fatigue that's disproportionate to their activity level. Low-grade fever can occur during flare-ups. Some develop firm lumps under the skin called rheumatoid nodules, particularly near affected joints. So what does this mean for you practically? If you're experiencing joint pain, these differences can guide you toward the right specialist. Osteoarthritis is typically managed by primary care physicians or orthopedic surgeons. Rheumatoid arthritis requires a rheumatologist, a specialist in autoimmune and inflammatory conditions. The treatment approaches differ significantly as well. Osteoarthritis management focuses on protecting joints, maintaining mobility, and managing pain. This might include physical therapy, weight management to reduce joint stress, supportive braces, and pain relief medications when needed. In advanced cases, joint replacement surgery becomes an option. Rheumatoid arthritis treatment aims to suppress the immune system's attack on your joints. Disease-modifying anti-rheumatic drugs, or DMARDs, are the cornerstone of treatment. These medications can slow or stop the progression of joint damage. Biologic medications that target specific parts of the immune system have transformed outcomes for many people with RA early. Diagnosis and treatment make a substantial difference for rheumatoid arthritis. Research indicates that starting DMARDs within the first few months of symptom onset leads to better long-term outcomes and can even achieve remission in some cases. Here's when you should definitely see a doctor. If you have joint pain lasting more than 6 weeks, especially with morning stiffness exceeding an hour, that warrants evaluation. Swelling in multiple joints, particularly if it's symmetrical, should prompt you to schedule an appointment. Sudden onset of joint symptoms, fever along with joint pain, or pain that's significantly interfering with your daily activities all deserve medical attention. Your doctor can order blood tests looking for inflammatory markers and rheumatoid factor, along with imaging studies to assess joint damage. Comment ready if you're going to pay attention to these symptom patterns and seek appropriate care if needed. And in my next video, I'll reveal the often overlooked connection between gut health and autoimmune conditions that influences long-term outcomes for conditions like rheumatoid arthritis. Remember, both osteoarthritis and rheumatoid arthritis are manageable conditions when properly diagnosed and treated. The key is recognizing the differences so you can pursue the right path forward. Understanding whether you're dealing with a mechanical wear and tear issue or an autoimmune process changes everything about your treatment strategy. This information is educational and not a substitute for personalized medical advice. Everyone's situation is unique, so work with your healthcare provider to determine what's right for you. Thanks for watching, and I'll see you in the next video.